have an ache, a pain, sniffle, or an itch, we often reach for over-the-counter medication for relief.
But deciding on an over-the-counter medication for your kids can be a little more complicated. You have to make sure you're giving the right kind at the right dose at the right time. So joining us with some advice on how to sort all of that out is our mid-morning pediatrician, Dr. Gigi Chawla from Children's Minnesota. Thanks for coming in, Dr.
Thanks
Gigi.
for having me again.
I've been there in that aisle, and you look at all this stuff and you're like, I don't know, is it safe to give my kids? Is it not? If it's not labeled for kids, can I do it?
Right. I mean, the aisle is endless. It's a $31 billion industry, of course. And so, yes, there's products for anything that you could possibly want to find for children.
Let's start with maybe some of the more common illnesses or injuries that you would need to look for over-the-counter medication for.
Yeah, you know, I think the most common over-the-counter medications for kids really are, first of all, multivitamins, so not about injury or illness. And then after that, cold medicine, allergy medicine, and sometimes treatment for constipation.
When you think about the risks, what are the risks associated with parents and caregivers when you're giving an over-the-counter?
Yeah, you know, I think really we want to make sure that patients are going to do it. Families are going to offer these medications.
These aren't normally dangerous, are they?
Yeah, you know, if you're following the directions to the letter, they're probably not dangerous. But there is something to consider for some of those medications, and that they're dosed by age and not weight. And there's a huge variation in how much kids can weigh or their body size, so we do want parents to be very conscientious about that.
So try to do it by weight if you can.
Right, and many of these medications are also combination products, and so they could be dosed differently per the combination, which also makes it very tricky.
What other kind of mistakes do you see parents making? I imagine that you probably see quite a few that come through.
Yeah, you know, some of especially the cold medicines, you know, those can be just downright dangerous, and so we generally don't recommend any type of cold medicine for kids. But I think when medicines are over the counter, people generally make up their own dosing.
They don't even read the directions.
They do as adults all the time.
Exactly, and so we worry about that for kids as well. You can overdose on any of these over-the-counter medications.
When do you think parents should go ahead and talk to a pediatrician versus just going through the aisle and picking something out?
Yeah, you know, the use of Tylenol or Motrin to treat a fever or an ache, that's absolutely reasonable to do. If it's going on for more than 2 to 3 days, we want to know what's going on. A multivitamin, if you're using it safely, just one each day, you know, they taste really good. So sometimes if you leave them out,
they
kids
are
can
good.
ingest
Like
a lot.
I will have those gummy vitamins that the kids have.
But too many of them are dangerous,
It's not candy.
right?
If it says kids, if you find it in the kids, I mean, is that safe to assume that you're in the right spot?
You are in the right spot, especially if you're still taking control of those medications and locking them up. And anything with iron in it is terribly dangerous for kids. So multivitamin with iron, be very careful with that.
Good. Great to know. Thanks, Dr. Gigi.
Thanks.